Dr. Madhusudan, you can start.
Okay, sir. Thank you. A very good evening, everybody. So, on behalf of Team Itamin, I'd like to invite all the participants, all my co-participants, and all facilitators for our assignment presentation. So, you all may be wondering why this name Itamin. So, we all know the origin of the word vitamin, vital plus amine, right? So, likewise, we thought our efforts are very vital to the success of this CBME program. Hence, we coined a similar sounding term, Itamin. So, our team name had to start from the letter E, and also nutrition was the topic assigned to us. So, we coined that name Itamin. So, at the very outset, I'd like to thank Sanjay Bedi sir for conceptualizing this wonderful platform, bringing together facilitators and participants from across the country. So I'm sure we have learned so much in our last 4 months, which we would have never learned in our regular course through CISP and revised basic workshops. Next, I would like to thank our mentors, Himashi Bhattacharya madam and Manjunath Nagaraj sir. So in spite of their busy routine, they have found time to clarify our doubts. They have handled us throughout our journey and provided critical inputs. Last but not the least, I would like to thank all our facilitators. Each of their sessions were very enlightening, and also we must thank their sincere and selfless commitment towards our field, community medicine, and also towards medical education. Next slide, please. So this is our team Itamin. So we have had participants from all the states and across various levels of seniority. Next slide, please. Yeah. So this is our presentation overview. So we'll be presenting in this order. Next slide, please. So I'll be presenting electives and also MCQs. So we have had a detailed discussion about what electives are. So we'll not be going into details. So to be brief, so electives will be conducted in 2 blocks of 4 weeks each after final phase part 1 exam. We all know this. So first block will be pertaining to research, and second block will be pertaining to some explorative learning experience. So the elective we have designed is pertaining to occupational health, which we can provide it in block 2. So location of the facility will be a tea factory at Ribbon, Wayanad district. So internal preceptor will be myself, and external preceptor will be an occupational health officer and safety officer from the same factory. So learning objectives of the will be to enlist the occupational diseases and hazards specific to this factory, to describe the medical and engineering measures followed in this particular factory to prevent those occupational diseases and hazards, to assess the compliance of this factory to the provisions of the Indian various provisions like pertaining to safety, welfare of the workers, pertaining to employment of young persons, pertaining to employment in hazardous processes, like the various provisions of Indian Factories Act and also ESI Act. So under ESI Act, the employer is expected to make some contribution. So they will be assessing these things and to assess the health status of the workers. Next slide, please. So number of students that can be accommodated in the elective is 5. So prerequisites of this elective. So this elective will be after final phase part 1 examinations. So hopefully students would have attended their theory and practical sessions pertaining to occupational health. So this is one of the prerequisites. They should have attended theory and practical sessions pertaining to occupational health. Learning resources for students. So they can read up any community occupational health chapter from any standard community medicine textbook. List of activities in which students will participate. So first, on the first day, they are expected to attend an orientation session pertaining to the elective. So they'll be briefed about all the do's and don'ts. Then they are expected to visit various sections of this factory and make observations pertaining to all our learning objectives. And then they're expected to perform a brief health checkup of all the workers. Then on the penultimate day or the last day, they are expected to present a seminar and submit a report pertaining to the learning objectives. So portfolio entries required. They are required to write down all their reflection on learning experiences in a 60 pages book, which they can submit to the internal preceptor after the end of the elective. Next slide, please. So logbook entry required, same 60 pages book. They can write down a brief of all their daily activities, which has to be signed by the external preceptor each day. Then assessment will be based on daily attendance, logbook and portfolio entries, and based on seminar presentation and report submitted at the end of the elective. So this is in brief about our elective. Next slide, please. So next I'll be presenting MCQ, assessment of knowledge by MCQ. So the competency we have selected is define and describe common nutrition related health disorders, macro as well as micro, their control and management. So SLOs we have selected pertaining to these competency are describe the clinical manifestations of endemic fluorosis and discuss the control measures for endemic fluorosis. So both of these objectives are under domain knowledge and level know-how. So these can be assessed by MCQ. Next slide, please. So this is the MCQ we have designed. So the direction is choose a best alternative. So the STEM is you are conducting a school health checkup in a PH area of Karnataka and come across a large number of children with chalky white patches on the teeth. Which of the following measures would you recommend in the PH area? So there are 4 options. So more than one option is correct here. So this particular type of MCQ belongs to the type multiple completion type. So they have to choose one best alternative. So both A and B, only A, C and D, and C and D. So why we have mentioned Karnataka is one of the endemic states for endemic fluorosis. Next slide, please. Next slide, please. So here option 1 is the answer and 2, 3 and 4 are distractors. So I was curious to check the effectiveness of distractors. So I tested it out on a small sample of interns of about 12. So I was happy to see that almost all the distractors, so they were effective. The response was more than 5% for all the distractors. So all the distractors were quite effective. So this is the MCQ we have designed. So next over to the next presenter for short note.
Am I audible?
Yeah, you
Yes.
are.
Good evening, everyone. Myself, Dr. Sharanya. I'll be presenting today on short note and scenario-based question. For short note, we have selected the competency 5.7, that is food hygiene. Under that, I have prepared the short note on 2 SLOs, that is discuss briefly the principle and procedure of test for detection of microorganism in the milk, and as well as the principles and different methods of pasteurization of milk. So both are knowledge domain and level is knows how. Next slide. So the question that I've prepared is, as a part of community medicine posting, you have visited a milk dairy and answer the following question. Discuss the different methods of pasteurization of milk with their principles, and discuss the principle and procedure for detection of microorganism in the milk. So both are for 5 marks. Next slide. Okay, now coming to the scenario based question. For scenario based question, we have selected the competency 5.3, which is define and describe common nutritional related health disorder, including both micro as well as macro, and their control and management. Domain is no, and level is knows how. So we have prepared the scenario question based on 2 SLOs. Next slide. So we have prepared 2 scenarios. Scenario 1, a 24-year-old woman of 24 weeks gestation comes to the antenatal clinic for routine antenatal checkup. On examination, she was found to have pallor. Laboratory investigation revealed that hemoglobin was found to be 9 gram percentage. The questions are, what is the dosage of iron folic acid tablets she should consume, and name one medication to be prescribed along with iron and folic acid. So 1 mark for each of the question. Second question, name at least 4 iron-rich food items that she should consume. So again, 2 marks. Next slide. So scenario 2, an adolescent girl is brought to the PHC by a mother with the complaints of feeling lethargic. On examination, the medical officer finds that she has a swelling in the neck. So the questions to be answered are, which micronutrient deficiency is responsible for the current health condition of the girl, and what is the national program to address this health issue in our country? So 1 mark for each question. Second question, what are the other health impacts of this deficiency among adult females? 2 marks for this question. Next slide. So next presenter, I'm handing over to next presenter, Dr. Ruchita. Thank you.
Good evening, one and all. I am Dr. Ruchita and I will be presenting long answer question followed by formative assessment tools for large group session, and after that demonstration of Socrative tool. So this is a long answer question. Competency chosen here is 5.4. Plan and recommend a suitable diet for the individuals and families based on local availability of foods and economic status, etc. in a simulated environment. SLO is describe a balanced diet chart for a pregnant female belonging to low socioeconomic status with locally available foods. So the domain is no and level is knows how. So the clinico-social case scenario which we have prepared is Mrs. Lata Devi, 22 years, married since 2 years, is working as housewife. Her husband is a rickshaw puller. Her monthly family income is 8,000 rupees. She visits UHTC of your field practice area with history of 4 months amenorrhea and complaints of tiredness, exhaustion, and occasional headache and giddiness. On examination, you find her weight to be 45 kg, height 150 centimeter, hemoglobin 9.6 gram per TL, BP 146 by 94, blood sugar 90 milligram per dl. She is pale, having pedal edema, and on counseling, it was found that she is worried as this is her first pregnancy and cannot afford any expensive interventions. Questions are, first, identify various health problems Mrs. Lata Devi is suffering from. This question is for 2 marks. What is expected from students is that hypertension and anemia, mainly students should focus on these 2 areas so that further next question can be addressed, which is second question is, what dietary advices will you give her with respect to her health condition, and prepare a diet chart for her keeping in consideration her socio-economic condition. 2 plus 3, that is total 5 marks. Third question is, describe how social status affects diet and nutrition during pregnancy. This is for 3 marks. So in total 10 marks question. Next assignment allotted to us was formative assessment tools for large group session. Here the competency chosen is 5.3. In which different SLOs we have selected, and for each of them various tools have been identified, after which these tools will be described briefly. So the competency is define and describe common nutritional related health disorders, their control and management. First SLO lists the common nutritional related health disorders. Here the tool used will be classroom poll and MCQs. Next, enumerate different indicators used to classify PEM. Here self and peer assessment can be used. Discuss the clinical features of PEM. 3 to 1 countdown and model answers can be given. Discuss the preventive measures and management of PEM. 3 to 1 countdown and exit ticket will be used. Discuss the signs and symptoms of anemia. For this, SAQ will be used as a tool. Describe the spectrum of iodine deficiency disorder. In this, model answer can be given. Describe clinical manifestations of vitamin A deficiency. For this, KWL chart and misconception check. Discuss the prevention of vitamin A deficiency with reference to vitamin A prophylaxis program. Here KWL chart. Then discuss briefly the prevention of zinc deficiency. Here 1 minute paper can be used to assess the students. So these are various tools. Some of them have already been discussed in previous presentations. So we will discuss this briefly. First is technological tools. In this, online quiz, MCQs, exit tickets, short answer questions, and true-false questions can be given to students. Most commonly used tools are Kahoot, Mentimeter, Quizzes, Peer Deck, Plickers, Socrative, and Google Form. The advantages of using technological tools are that they give quick and immediate assessment, they are paperless, and they keep students engaging and attentive. Next is self-assessment and peer assessment. For this, various forms or checklist can be formed to which students can respond to a set of number of trigger questions. The advantage is that students become more responsible for their own learning and they get individual feedback. The example which can be used for self-assessment or peer assessment is that by asking students to swap the answer sheets or scripts with one another, or by collecting all the scripts and then randomly assigning them to different students for marking. Next is model answers and feedback. Preparing a feedback sheet with a list of most common problems and frequently asked questions, and then uh, showing or giving this model answer or explanation to students becomes really helpful sometimes to students, because if you see this iceberg picture, in this knowledge and skill gap, which we usually identify by using various assessment tools, is just the tip of iceberg, and most of the gap remains unidentified due to various reasons, maybe sometimes due to deficiency of previous grade learning, and sometimes due to use of improper or inadequate assessment tools. uh, One of the method to address this can be model answers, which can be showed to students or explained to them. And also verbal feedback and suggestions on how to improve further can be given. And suggested reading from various books, materials, or online or offline materials can be suggested to students. Next is 3 to 1 countdown. Here the students are given cards to write on, or they can even respond orally, and they are required to respond to 3 separate statements. For example, 3 things you didn't know before, 2 things that surprised you about this topic, and 1 thing you want to start doing with what you have learned. Another way is 3 things you found out, 2 interesting things, and 1 question you still have after today's topic. 3 differences between 2 effects on 1 question you still have about the topic. Also 3 different facts, 2 interesting ideas, and 1 insight about yourself as a learner. 3 keywords, 2 new ideas, and 1 thought to think about. So these all are different ways in which 3 to 1 countdown can be used. This is an interesting way in which students can reflect their ideas, what they have understood, and what they need to know still more about this topic. Another tool is KWL chart, that is know, want, and learn chart. This lets students organize and analyze the information from a lesson or the topic. It is a great critical thinking tool, and it gets students interested in new topics. The questions which are asked are, what do you know already? That is the K for know. What do you want to know? And what did you learn? So know, want, and learn chart, in which student will write, and then based on that the teacher can assess what is the level of understanding and what the student already knows and what the student needs or wants to learn. Another is classroom poll, and the most common technique is thumbs voting, in which the teacher asks for thumbs up from students if they understand the material or the topic, thumbs down if they don't, and the thumbs sideways if they are unsure of anything or have any doubts in the given topic. So by this, if there is some doubts or something is not clear, it can be further addressed. Another tool is exit ticket. So they are small pieces of paper or cards that students deposit when they leave the classroom after the lecture. But this can also be conducted on online platform. In this, students write down the accurate interpretation of what the idea or what they have understood after the lecture they have attended. Another concept besides exit tickets is also admit tickets, which is done at the beginning of the class. Students respond to questions about homework or on the lesson taught the day before, or it can be used to also assess the pre-lecture knowledge, so that teacher can understand the level of knowledge or understanding of students before starting the lecture. Next is misconception check. Uh, in this, we can present students with common or predictable misconception about any given topic or principle or process, and then ask them whether they agree or disagree, and then based on that explain why. They have to explain why they agree or disagree, and then the misconception regarding whatever the topic is can be clarified by the teacher. So this misconception check can be presented in the form of MCQ or even true or false. Next is 1 minute paper or 1 minute reflection writing. A student can work individually or in groups, and they must answer a brief question in writing to the typical questions which generally teachers will give, like what was the main point, most surprising concept, questions not answered, most confusing area of a topic, what question from the topic might appear on the next test. This is the end of this assignment, and as formative assessment is all about learning, and we are all becoming. It acknowledges and celebrates the fact that no one is perfect, and it isn't everyone gets a trophy so much as it is everyone gets better every day. After this, I will demonstrate the Socrative tool. This is the online tool. For this, I need all the participants should log into this socrative.com, and after going to socrative.com, they can uh, click on login, in which they can go to student login, or even if they write Socrative student login directly in the Google, it will come. So I request all the participants to please log in to socrative.com student login. Uh, I will try to demonstrate this, how to log in. So here I have logged in to Socrative student login, and then this is the screen which I will be able to see. And in this room name, you can enter Etamin, EATAMIN. After entering the room name, you will be able to join. I request all the participants to please log into Socrative. Once you enter the room name, you will be required to enter your name. You can enter any name. Okay, so this is the screen which is visible is my screen, that is teacher's screen, and I can see here that 32 participants have logged in. You will face 5 questions. Please answer them one by one. This is the live table which I am able to see. After giving all the answers, you will also receive your final score in your answer sheet, on your screen, I mean. So total in this screen, total I can see 34 participants have participated in this, and here I can see the names and the progress. These are the 5 questions which were asked to all the participants, and these are the answers given by them. So now I'll finish this quiz. Okay, so we have finished the quiz, and now if I go to report section, I can see Okay, so I finished the quiz, and now I can go to this tab, Export, and from this there are various options. Suppose I click on Complete Result Excel, then I will get all the result in my Excel sheet. This is individual student PDF, in which individual students' result can be downloaded, then result summary PDF and answer key. So if I wish to get this result in Excel sheet, I can download it in my Excel sheet, and this is how it will be visible. So this a whole Excel sheet I have got. This was Itamin's assessment quiz conducted on this time. All the names of students, their total score, number of correct answers, and these are the questions and the answers which the participants have given. Now, even if when I go to I can when I go to into report section, I can even email to students their individual reports. So this is the teacher's login screen. There are various rooms in this page. If I go to rooms, this is the room which I have created called Itamin. Presently, in this version, only one room can be created. If I wish to create more rooms, then it has to be upgraded to Socrative Pro, which may be the paid version. Another tab is this quizzes, which can be used to create the quiz. This is the quiz which I have created in this, and this I can also share if I wish to share with any other colleague or anyone. I can create this link, copy and send directly this. This also can be downloaded and copied in any other Word document also. If I wish to create another quiz, I need to add quiz, and I can easily create another quiz. After creating in this, I have to launch. So I will have to click on launch tab, and then this quiz. This is a quiz which I have created. So these are the three ways in which I can launch. So first is instant feedback, in which student answer questions in order and cannot change the answers, and instant feedback is provided after each question, and you can monitor the progress in a table of live results. This option we just demonstrated right now. Another is open navigation, in which student may answer questions in any order and change answers before finishing, and you can monitor the progress in the table of live results. And another is teacher paced, in which you control the flow of questions and monitor responses as they happen, and you can skip or revisit the questions. After selecting any option, I just need to start, and it will automatically start the activity, and I can see the live results. So these are the various options like quiz, space race, exit ticket, which are available, and questions like MCQ, true false, and short answer questions can be created in this. Space race is basically when we need two groups or two teams which are competing with each other. Quiz, which we just demonstrated right now, and there is another activity, that is exit ticket. So these are the questions of exit ticket, that how well did you understand today's material? What did you learn in today's class? And please answer the teacher's question, which teacher can say orally or can show on the board. And again, this is the same way these questions will appear as we just demonstrated in the quiz. After this, again, once we finish this activity, the results will be available in the report section, which can be imported into Excel or PDF. So this is a very good way to assess the students immediately by using online tool. So that's all. Now I invite Dr. Manish sir for presenting further part.
Dr. Manish, are you
Oh,
there?
yeah. Sorry, extremely sorry. So yeah,
Yes.
let's move to the small group session. So there are various formative assessment tools available, and these are discussed in the previous sessions. So today I'm just having a OSCE and this mini dry erase board to discuss. And DOPS will be going discussed by my other colleague. Next slide, please. Next slide, yeah. So for this, we had a OSCE station where a student has to measure the body mass index of a particular patient in a non-communicable disease prevention clinic. This may be any nutrition clinic you can consider it, or maybe in a community setting. But for this particular session, we kept it in a clinic. Next slide, please. Next slide. I'm not able to see the next slide.
Yes, I am trying. Just a minute.
Okay. Yeah, so this is the OSCE checklist where we have almost 13 point, 11 point you can see here, from introduction himself, herself to the patient, explain the process, which will carry 1 mark. Similarly, there are points like taken verbal consent and explain the process, 1 mark. Mention a studiometer, weighing scales are calibrated. Asked to remove the shoes, socks, cap, or to have a minimal clothing. Instruct to stand the straight arm hanging using to the side feet together, and this 6th step, and this the 8, 9, 10, 11 who are highlighted here in the red color. These are the very critical steps in the procedure or in this checklist. So this is student has to get the marks for this, or she or he has to perform well in these critical points. So next slide, please. So 12th and 13th points are communicate, find the patient in a proper way and gives appropriate advice in whatever BMI of that particular patient in the reference range. So it is carried 2 marks. So total allotted marks for this OSCE station with this checklist, 15 marks, and we will rate the student if the marks is less than 5, it considered to be a fail, and 5 to 10 is borderline, and more than 10 plus critical step performed correctly, then it is a pass. So here in this checklist, critical steps is expected to perform by the student. So if more than 10 and any of the critical steps not performed, then appropriate feedback would be given, and whatever remedial measures are there we need to take. Next slide, please. Yeah, so that was related to OSCE station. One another important, I came across this mini dry erase board, so I thought just discuss this another method here. So this is not a very high tech technology based. It is purely with the chalk and board, and where the student can write the whatever information they discuss with that particular topic. So maybe they share their ideas or their any understanding or any new concept. By taking a quick visual assessment of the student, what we can respond to what or the how the student is learning. So this is the one important thing I would like to share with you. So this is very easily can be done. Yeah, I think this is my last slide, and I would like to call upon Dr. Chitra Madam for the next presentation or continue the presentation. Chitra Madam, please.
Good evening. Good evening, one and all. I'm audible, isn't it?
Yeah,
Madam,
Yes,
audible.
So I will be taking these jobs. As we all know, under CBME, the total priority is towards skills and the ability of the student or an intern to perform. So as we all know, the DOPS is directly observing the procedural skills. So for this assessment or assignment, I've taken the competency of 5.2, which is demonstrate the correct method of performing a nutritional assessment of individuals and families using appropriate methods. Now the competency is very big. There are so many methods we use for nutritional assessment, but we'll be sticking to one which is easily feasible and we can do it. So specific learning objective would be demonstrate the correct method of performing a nutritional assessment of an individual using anthropometric measurements. Then the student or the intern should be able to interpret the anthropometric measurements correctly and explain the findings of the nutritional assessment to the individual. So this we take as a formative assessment. So the assessment will take place while the trainee is performing the activity. And actually when we do these kind of skill observations, the student or the intern should know that what we are assessing. So it's very important that they are also knowing what is there in the checklist and perform accordingly. Why I'm saying this is we have at least all these 40 years, I've never seen anybody teaching that you greet the patient, make them comfortable. But when we have checklists like this, we are giving marks for that. So the students should be taught and they should know that they are assessed on this so that they do it correctly. And the assessor here will be using a checklist. Next. Next slide, please. Okay, so we have initial demographic data of the evaluator, date, the student's name, roll number, then the patients, whomever they are testing, their details. Then next one is the next slide. Next slide, we can have for whatever activity we have, we need to prepare a checklist like this. For this SLO, here again explains the purpose, the activities on which the student is assessed is, explains the purpose of the visit to the individual, takes consent, correctly records height or length, correctly records weight, makes the BMI calculation, under 5 children, relevant mid-arm circumference they can take, waist and hip ratio can be measured and calculated, Broca's index. Then with all these findings, they need to interpret whatever measurements they've got and explain the situation of whether the person is undernourished, overnourished, and whatever they have to do. So the rating will be below expectation, borderline, adequate performance, above expectation, or not observed. Immediate feedback can be given to the student about his or her performance. And if the student is not performing to the expectation, then will have to be given remedial action and again made to re-perform. Next, next slide. It's very easy to say we can assess. Majority of the colleges have 150 students, but nowadays more colleges are having 250 students. Proportionate increase is not there in manpower. So if you're going to have too many activities to assess, it is going to become next to impossible to really do it in a proper manner. So manpower, the feasibility, all these factors are going to come into play. But to simplify, we can, instead of going to community, taking more time, if you really want to assess, we can use the batches of student. A 6-term or 7-term student can conduct the assessment on a first year, and we can observe it. So this will save time and resources. So for all this, faculty needs to be properly oriented and trained on how to use the rating form to maintain uniformity. So that's all. I now call upon Amrita to continue with the logbook. Amrita.
Good evening, everyone. Can you all hear me?
Yes.
Yeah, okay. So I'll be telling about the logbook. So for logbook, the activity which we have chosen is a visit to Primary Health Center, Nandagudi. The competency which we have chosen is to describe the primary healthcare, its components and principle. And the SLO which we have chosen for this logbook is to enumerate how the documents of National Tuberculosis Elimination Program is maintained at the PHC Nandagudi. So we are going to see all the documentation process regarding NTEP, if it is taking place correctly or no. The components of this activity, so before starting this activity, the prerequisites for this, like what the students are supposed to read before going to this is, the students should know how to define primary healthcare, and they should know the principles and elements of primary healthcare. They should be able to list out the services of primary healthcare, and also with respect to National Tuberculosis Elimination Program, they should know about the program, and they should know the role of PHCs in the documentation of NTEP, like what all the primary health center has to do with regard to National Tuberculosis Elimination Program. So everything the student should know before the visit. The criteria for successful completion would be, for successful completion, the students should be able to enlist all the documents which are required to be maintained for the NTEP under the program, and also the students should verify all the documents, and they should check whether all the documents are up to date, and if all the documents regarding NTEP is available in the PHC or no. So there's a checklist. Yeah, so this is the checklist of all the documents which is maintained at PHC regarding, I mean, with respect to NTEP. So the student, like, they should check whether the tuberculosis notification register is present and if updated, up to date, and the TB lab register, tuberculosis treatment register, transfer in and transfer out register, the supervisor register, and the multi-drug resistant TB register. And also the student should check whether the NICSHE entry is being done regularly or not, and whether the NICSHE ID is generated for all the tuberculosis diagnosed patients. And for the requirement of correctly doing the NICSHE entry, a proper internet connection is required. So also we should check whether there is a proper internet connection, an uninterrupted connection, so that the NICSHE entry takes place smoothly. And according to the NTEP, there should be a lab technician should be present in a PHC who will do the sputum microscopy and who takes care of all the things related to tuberculosis. So this is all the checklist with the students will be verifying in the PHC, and at the same time they should verify each and every document, and they should also see to it that it is updated. Next slide. Next slide, please. Hello. Hello. Hello.
You
Yeah.
are audible.
Yeah. Then yeah. Yes, ma'am. Yes. Yeah. So the next slide. So this is the format of logbook which is given by MCI. So in this we have the competency. So I've mentioned that competency 7.3, which we had used, and the SLO like enumerate how the documentation of NTP is maintained in the primary health center. Name of the activity would be field visit to primary health center, and the students had visited on 1st December, and attempted activity, this was their first attempt, and then it met the expectation, and the activity was completed as the students had verified all the documents which are necessary. Then comes the initial of the perspective and the feedback. So this is how the logbook will be documented after the field visit. So so this is like I mean, this is the end of our assignment, and all of us we would like to thank Sanjay Bedi sir, and we would also like to thank Himashri ma'am and Manjunath sir for their constant support, and also I would like to thank all the group members of team Itamin for all the support and all the guidance, and yeah, so we are done with today's presentation. Thank you, everyone.
Thank you, Dr. Amrita, and all the presenters and the entire team Vitamin for a very nice presentation and an elaborate presentation. So we will move on to the questions. Let us see what are the, if we have questions. There is one question by Dr. Prasad Pore. In question of goiter, am I audible?
Yeah, madam, you are audible.
In question of goiter, instead of is verb, may verb is better. Yes. Just 1 minute. Swelling over neck doesn't necessarily goiter unless examined in detail. So I feel in question may word should be there. Okay, okay. Thank you, sir. Any comments regarding this from the presenters? We can move on to that particular question. Dr. Ruchita, you can just go to that question on goiter.
Madam, it is maybe only, madam.
Next one. Okay.
It's maybe only.
Go.
It's maybe only, madam.
Okay.
Maybe.
May be responsible. Okay, we have written maybe only, so that answers the question. Yeah, that's the correct point. Then another one is in another question is by Dr. Kokila. In OSCE, what is the minimum number of station? Would anyone like to answer that question?
Yeah, this is Manish. This is the OSCE station is only one here, and we had 15 marks for one OSCE station. So we have 13 questions for this 15 marks, and because this is the exhaustive list of the procedure or the point to be considered in anthropometric measurement, so this 13 points we have to.
Okay, thank you. We
Can I
don't have
say-
any more questions. Yes, yes.
Can I add here something?
Yes, yes,
Yes,
please,
sir,
Dr.
please,
Parag.
please.
Yes. Probably Kokila madam wishes to ask that usually in medical education workshops we specify the minimum number of stations for an OSCE exam. Now that would be true when we are using OSCE, let's say for internal assessment or for any other formal exams of the students. Here, the way they have used OSCE is probably within a teaching session. Probably they are proposing to use this as a formative assessment tool where this small number of students are going to be assessed. So Here probably not we would probably it would the question of having a minimum number of stations would not arise, because within the teaching session we are using OSCE. And personally, I would welcome this, because when we share the checklist with the students during the teaching session itself, then the student become prepared to face the same checklist during the internal assessment exam also. So that way, I see it as a welcome step. Thank you.
Thank you, sir.
Yes,
Thank you, ma'am.
exactly. Yeah, thank you, Dr. Parag. Exactly, that is what we were wanting to highlight. We are just using it as a formative assessment tool within a teaching learning session, so that as we come to the concept of formative assessment now, how to practically implement it. So I think if we can incorporate it in our day-to-day teaching learning classes or sessions, then it would be more productive. And the point highlighted by Dr. Parag is very nicely, yeah, he has exactly cited what our group has exactly thought about it. I would like to invite more comments from our facilitators and participants also. If they have any questions, please put forward. Any query, any comments from our facilitators? Yes,
Madam
Pankaj sir,
Pankaj,
please. Yes, sir.
two things with respect to the first question of the word should be may or whichever word is appropriate. Using the word is in a question is very, very important, because it may make a different meaning to different people in different contexts also, and also in different cultures. But when we are doing these kind of sessions, we need to understand we are looking two aspects. One is the aspect of process, and second is the actual academic or the technical content. Both are equally important, but we also need to understand right now we are in CBME training program. We are concentrating on the process, because all of us are well versed more or less about the technical content. Since we are from the same group of community medicine, technical content can be easily sorted out. But the most important for all of us is to learn is the process on how the scenario should be created, how the questions can be framed, what are the appropriate places, venues, and the methods which we can use it. And not all the times all the methods can be used like a sandwich. That is one. Though it is a word may or something, but it's very important to understand the process. And once we have understood the process, implying to a particular subject will become very, very easy task, as we are technically competent to decide what is the best suitable for undergraduate and postgraduate. In the same question, second thing is many of the places, I don't want to bring that question or the scenario, the appropriate words can be rephrased in the form of they have used mention or name or somewhere, probably list or some other appropriate word can be used, which can be better. Third comment with respect to OSCE, now we need to understand this. Somehow we are very happy with preparing the checklist, and this comment I had used earlier also, maybe taken as a critical or maybe in other way as a major difference of opinion. As an educationist, we are very happy in creating documents and checklists. Longer the checklist, the fatigue will come to the examiner or the assessee, and it will not serve the purpose. So I'll be very happy to have as smaller the checklist is, as specific the content is, and specific item to be measured by the checklist. Though, as Parag said, having a nutritional assessment is one of the major tasks for an individual or family. But probably what I feel, even if I want to train a student, nutritional assessment is probably a larger domain where I'm looking at. I'll be very happy to break down further into a smaller component of nutritional assessment and teach in that fashion. First, I'll be more specific. The checklist will be lesser. 20 minutes observation per student is not required. Otherwise, if I am a faculty or I am a poor postgraduate student or a poor attender or a technician, for 6 students, I'll be observing at 120 minutes, and probably that will be may not be feasible for them. So I'll prefer a OSCE even at a formative assessment wherever possible. I'm again marking my words and calculating my words wherever possible. Have smaller checklists, smaller OSCE. The advantage, the learning can be more and specific to the target point what we want, rather than having a 20 minutes OSCE and say out of 50 marks, if the student learns 25 marks in the nutritional assessment is very good. At the same time, the smaller OSCEs can be easily implemented in the exam. Implementing 20 minutes of a nutritional assessment in the exam, except in a case of a long scenario, may be very, very difficult. And if I take the question again in the technical front, for families, then for families means many members in the family, again is going to be more complicating. So on some points I agree with Madam and Parag, and somewhere I have a small amount of difference of opinion. Sorry for the difference of opinion. Thank you.
Yes. Thanks a lot, Pankaj sir, for a very nice input on that. Actually, this hadn't gone into our mind when we had framed the things. Using of smaller OSCEs will be very much helpful actually for formative assessment when we are planning to do it on a day-to-day basis, especially. So this is a very point which is very much well taken. Do we have to keep smaller OSCEs for summative assessment also, sir? Would it not make it like, what is your comments or the comments of the other facilitators on using smaller checklist for summative? Will it not make it less specific, or
can I take 1 minute on this? Can I take 1 minute on this? Sir,
yes.
Madam, if you say OSCE or OSPE, if you expand, the term O is very, very specific. That is objective.
Yes,
sorry, I'm just out of my mind. Sorry, I just suddenly lost. What I wanted to say is the purpose of OSCE is a checklist. Now, as Manjunath sir was telling last time, there can be a response or OSCE or OSPE, or it can be procedural. The problem comes in the procedural because somebody has to observe. And if it's a summative exam, only the examiner has to observe, not my PG or not my expert or not my assistant or somebody can observe unless that person himself or herself is the examiner. In such cases, having very too much OSCE of a procedural nature will have a problem, because as you know how the exams are being happening, unfortunately many of us reach late on the first day and want to leave on the last day early. Evenings we have planned, thanks to COVID at present, that many of these exams have become virtual exams. But there are a lot of other limitations which come into picture, like theory paper correction in the evening or in the afternoon or during the session of the practical, where the students are doing some spotters or exercise. So unless we have a proper observation of a procedural OSCE or OSPE, it will be very, very challenging in the summative examination. As we have discussed earlier, many times I think Parag or Manjunath sir or somebody said that many times those spotters are becoming glorified OSPE and OSCE and being used at n number of times.
True, sir, true. Agree to that, sir. Yeah, we can consider these things. Like the feasibility aspects are very much we have to think when we think about implementing things like OSCEs and DOPS into our formative and summative assessment. Any further comments from our other facilitators on this?
Sorry, madam. Can I just come for half a second more? I am not able to resist myself. Summative assessment is just one part of the life. Formative assessment is throughout the life. So what I understand, in exam for every student, every faculty, the summative assessment becomes most important. But in the true life, formative assessment is the most important, and summative assessment is just one event in our lifetime. But formative assessment is the most important. If somebody becomes good in a formative assessment, I don't think so they have to worry at any point of time summative assessment. Unfortunately, as an examiner, as a student, as a faculty, and as a society, we give too much importance to a summative assessment rather than formative assessment. Sorry, madam, for repeatedly occupying so much of.
It's okay, sir. Your inputs are indeed very, very helpful, sir, and takes into consideration the practical aspects. So thank you so much, sir. Another query was raised by Dr. Somdatta actually in the faculty group. She was asking what is the difference between one station OSCE and DOPS. Would anyone like to give their inputs on this difference between one station OSCE and DOPS? Any participant or our presenters also are welcome.
I don't think there's much of a difference. It's just play of words. If you ask me, the most of the things are play of words.
Okay.
Can I answer that?
Yes, please, Dr. Parag.
Thank you, Chitra madam, for sharing your opinion. Actually, ma'am, Chitra ma'am, if we look at the educational literature, there is a distinct difference between the two. Probably we have covered this earlier also. I'll just very quickly try to recap what we have earlier have been saying about this. So, as I understand this, OSCE would be a detailed checklist wherein someone would observe on the student performing the task step by step. So each step would be observed, and there is a checklist. So here also, let's say your group have prepared a very nice checklist. So all the steps are mentioned. Now, what for this group, the version of DOPS that this group has prepared looks very similar to OSCE, probably because of the notion that's prevailing maybe in this group, that both of them are same. Actually, they are not. So in DOPS, what we use is global rating scale. So what we mean by global rating scale is we identify only the themes or areas. So for example, in clinical subjects, those themes or areas could be history taking, communication, and physical examination, and so on. So when they are using such kind of things, in let's say I'm talking about mini C, it's not exactly DOPS, but similar themes would be there for DOPS also. So the same checklist of the DOPS might be useful for multiple procedures. That's not the case for OSCE. So if you have OSCE for a particular thing, the steps would be different. So for each of those skills, OSCE checklists would be different, but the DOPS would be same. So in DOPS, the teacher need not go through each and every step. The teacher would decide that and DOPS is primarily to be used in what we call it as the real life setting, or work. DOPS is more of a workplace based tool. So to me, let's say for a third year part 2 student or an intern, DOPS would be a more appropriate tool to be used, where the teacher would rate the student based in real work situation, and let's say in real life situations, out of 10 different items on an OSCE checklist, 2 of them they are not really relevant to that situations. So in an OSCE checklist, you have to fill up that step, whether the student performed or not. Whereas in DOPS, the teacher has the liberty not to observe the student on this, and neither the student also knows that in this situation this was not required, so I did not perform that. The teacher also does not pay attention to that step. So that way, there is a difference between the OSCE and DOPS.
And then what's
I
the
guess.
difference between DOPS and workplace-based assessment?
Ma'am, DOPS is one of the tools of workplace-based assessment. Workplace-based assessment is an assessment, is a concept in assessment, and for that we have multiple tools. So for procedural skills, the one of the tools is DOPS. For clinical examination, one of the most commonly used tools is mini CEX, as we know. Yes, ma'am. Yes, ma'am. So DOPS is just a tool, ma'am. Like OSCE is also a tool. So same way DOPS is also a tool.
Thanks a lot, Parag. It's very relevant, actually, the thing. Actually, to summarize, I think the main critical areas from the OSCE checklist are to be put into the DOPS. If we can compare two procedures, basically DOPS is for the procedural skills, and basically we have to just put the critical areas, which we had
Yes.
like checklist. Now that is the
Yes.
thing. We need not highlight each and everything. Just to only the must know or the very critical areas are to be highlighted in the DOPS checklist.
In other words, if I could say that a few of the steps of the OSCE checklist would be clubbed together in under one or the other themes in DOPS.
Okay, thanks a lot, Parag.
Madam Pankaj.
Yes, Pankaj sir, yeah.
I will go to other extreme. This I have told earlier also, again to repeat, emphasize. If we are not sure what terminology, title or mnemonic has to come, we can forget about it. The most important, if my competencies can be assessed proper way, that's my terminology. And we have, as sir was suggesting, Manjunath sir, we have to evolve with the Indian mnemonics and Indian terminology. We can evolve with our own terminology. The purpose is the competency needs to be assessed. Many times there is a thin border between so many assessment methods, and we do not too much worry about those terminologies at present.
True, sir, true. Basically, our idea is to assess whether the competency has been achieved or not. And that has to be done in a proper way. That is the main idea about the entire assessment process. Thank you, sir. Any further inputs? Yes,
Dr.
Dr. Parag.
Himashri, I had few questions and then comments. The first question I had in my mind is that the team has very nicely mentioned and very appropriately mentioned the formative assessment tools for SLOs. So that probably they spent a lot of time and identified the appropriate methods. If you can go through that slide for a moment. The question that I want to ask to the team is that these were different SLOs, and I don't know in one particular large group lecture session how many SLOs that the team wishes to take up. It might be 2 SLOs or 3 SLOs or 4 SLOs and so on. So my question to the team is, in one lecture session, suppose in large group, how many formative assessment tools they wish to use?
Dr. Ruchita, you can come. Yeah. Can you just repeat the question, Dr. Parag? In one particular session, how many assessment tools
Yes.
you would like to use? Na?
So here we have identified one tool per SLO. So does the group wish to convey that in one lecture one formative assessment tool would be used, or am I to believe that in one lecture session, if there are 3 SLOs, there will be 3 different formative assessment tools used?
Okay.
Yes, sir. Actually, multiple tools can be used in the single lecture. For example, like a classroom poll can be used for this SLO. And if we are addressing this another SLO, if we are taking the lecture, another tool can also be used. Sir, it's not necessary that a single tool can fulfill the assessment need of all the objectives. So at the end, model answer can also be given, and exit ticket can also be used. So various multiple tools can be used, in my opinion.
Okay. So, madam, here I'll just like to share that technology has made it easier for us to use all these tools. Just one caution that when we are using these tools for the first time, we need to be acquainted with its usage, and then the students also need to be acquainted with its usage. So, I would raise the caution that when you are doing it for the first time, please start with only one tool at a time. And once you and students become comfortable, then you can start using more than one tool in one particular session. That's what we have observed, that if we to make too much of use of these tools, sometimes it becomes overwhelming. The primary
Yes, sir.
purpose is that the students learning.
Yes, sir. Firstly, both teacher and students both needs to be very well acquainted with that tool, and then only it will be more. It will solve the purpose.
Thank you, ma'am. Another question is with regard to the electives. Uh, uh, we have seen now through these presentations the multiple electives. Now, two questions that stay in my mind, and they have continued to stay in my mind. One is about how do we make electives more attractive to students. So, if the electives that we are thinking about, if they were there on the list of electives which the students are supposed to be choosing, so is it attractive enough that we will find students choosing these electives compared to the others? So that's my question. Probably I do not expect an answer right now, but probably that's something that we should be thinking about. How do we make this attractive to the students? And second thing is, I'm constantly asking for this is whenever we plan an elective, we should also be thinking about uh, am I exposing my students to potential career options in this particular area through my elective? Uh, uh, am I showing my student the real world situation in a career for this in this particular area to my students? That's also one of the important things that we should be keeping in mind.
Yes. Agree to that. Yeah. So while we can keep these electives, but actually, yeah, to make it more attractive to the students. And Dr. Madhusudan, would you like to come in? I think you have been
The second part of the
posing
question of
some of
Parag.
the. Yes.
So the elective we have formulated is with respect to occupational health. One of the subspecialty of community medicine is occupational health. So we'll be orienting to the students towards that in the factory setup.
Okay, so then probably the student would be more interested in learning the day-to-day life of that particular occupational health officer, what he or she does, and what all maybe other trainings that the student needs to have, needs to undergo after MBBS maybe to become an occupational health officer.
Yes.
And probably we need to show them that this is also a lucrative career option.
Yes, sir. Yes.
Yes. So yeah, apart from
Parag,
that, actually, yeah. Yes, I would just quickly like to highlight. Yes, sir. Yes, sir. Pankaj, sir, please.
no,
Yeah.
no, just a few seconds, just on the lighter sense. If I am not from Kerala or Wayanad itself will be an attractive option for elective. Leave all other issues of academic.
Yes, sir. True, sir.
Thank you, Pankaj sir.
Yes, sir. Two comments which was raised by Animesh sir, I would like to quickly highlight in the group, which he had put in the WhatsApp group. So one is workplace-based assessment can also help to look for situational awareness, leadership, teamwork, which may not be possible in OSCE. This is a point which is very nicely highlighted by Animesh sir. Another thing is which sir has highlighted it is on slide 14. Can we go to slide 14? He has said that they had mentioned about some visit, I think milk factory or so, then the short answer question is followed. So according to sir, it is not necessary to have the window dressing that is mentioned about the visit, as the question was rather theoretical and not connected to visit per se. You have visited, okay. So according to sir, the is theoretical, and we have mentioned that you have visited a milk dairy. But that can, okay, if they must have visited, then we can, I think there can be no harm if we can just put it. Then they can recall their visit to the milk dairy, and they can also give inputs on that. If they have visited the milk dairy, then we can definitely put it as such. What is the comments of the other facilitators or the presenters?
Dr. Himashri, can I come?
Yes, yes, Dr.
Yeah.
Parag.
Thank you, Animesh sir, for pointing this out. Let's say if I were to improvise this, one of the ways could be that asking the student which method of pasteurization was being used when you visited this particular milk dairy. So out of the multiple methods, that dairy might be using one. So if the student has visited and understood, probably that, I mean, that would then not be a window dressing.
Yes, true. If it was linked to the, okay, we have a, yeah. So both aspects have been understood quite well. Even Animesh sir's point is very valid. And if we have to put a visit, we have mentioned it, then we have to ask in relevance to that visit. Point well taken.
Madam, one more thing. As Animesh sir told about that question needs further improvisation, and Parag also said we can improve it. But one of the caution what Parag told me, I want to bring to everybody's notice, which method they use during the visit. Many times when we have a question bank of formative assessment questions, they unfortunately somehow come in the summative assessment when the question paper is prepared. If the same question by mistake goes into the summative assessment, which method they use during the milk visit, it may be become critical with the marking thing, and each batch there can be some differences, different visit, and all those things can come out. And if it's a central university, a health science university of government, really that question will create a major hawk among all the students when they are about to answer. So we need to be very cautious when we are asking with particular important visit, should not turn up in the summative assessment.
Yes, sir.
Dr. Himashi, I have one last
Yes,
comment.
please. Yeah. Please,
That is
Doctor.
about the logbook. Uh,
Yes.
I would wish to know from the group what exactly is the student supposed to be performing that a teacher would also observe and decide whether it meets the expectation.
Hmm.
What could be the duration of that activity that each student would be observed for what amount of time?
Yes, Dr. Amrita, would you like to answer to this question?
Sir, could you please repeat the question? I couldn't hear it properly.
Yes, ma'am. So when we are saying that we are doing a logbook entry for this activity, and we understand that for activities we are choosing for logbook are such where each student would be observed doing that activity by the teacher.
Yes,
So
yes,
what
sir.
exactly, I mean, I could not gather what exactly would the teacher observe each of the students doing. And let's say for how long would teacher observe each student for what amount of time?
So, like what I had thought in mind by preparing is that we can observe the students, like in what sequence and what all documents they are going to verify, which is related to NTP. So, I've not thought about like how long to observe a student. I haven't thought about this thing, sir. But I thought we can just see while they are, because first I had thought of just giving it to the students when they will see what are the functions of faith. So that would have been very simple. So we just thought of doing this documentation thing. So.
Yes. No, ma'am, I appreciate the idea of extending it further. Probably we can refine it more further and identify a specific thing which we expect that this is something which a
Students.
visit doctor should be doing and which is
Okay.
observable. Otherwise, I mean, if there is not something which is very specific to be observed, this could be part of
Yes.
the common clinical posting where the students are demonstrated all those things. So, I mean, looking at the different types of registers, we would probably not expect every student to be demonstrating this particular thing.
Yes.
Yes,
Yeah,
sir. Yes,
yeah.
sir. Yes, sir. Yeah.
Yes, Dr.
So,
Parag,
ma'am,
very nice.
Yes, sir. Thank you. Yes,
so
sir.
the take-home message for me then would be that when we choose the logbook, I mean, choose the competencies to be logged for community medicine undergraduates, we will have to be very judicious because otherwise it would just become any other practical record book kind of a thing. When we say logged, it means that the teacher has observed something on each of those students, and then for each of the students, we are deciding whether what student performs, whether it meets expectations or doesn't meet expectation, and so on. To me, now, as we have discussed so long on logbook, and probably at many colleges, the preparations have started. Uh, I wonder whether we will have in community medicine something which would be so bulky and can be called as a log book. I would not be really surprised if I can have a log page rather than a log book. As Pankaj sir says, and I'll use Pankaj sir's word, I might be putting controversial things here, but really, I mean, those are my thoughts that I'm leaving. That we should not be taking up too many things to start with when we are doing logbook. I mean, open to all the other facilitators on this.
Yeah. Thank you, Parag sir, for your this thing.
Thanks a lot, Dr. Parag. Very nice inputs. Actually, we should be very judicious when we think about this documentation process. I have a question to ask. We have so many visits in community medicine. Like we go to visit the PHC and all. I don't think this needs documentation in the logbook, isn't it?
Yes,
Do we
yes, I
or do
agree.
we have a separate manual for that better?
Yes, I agree. Not all visits needs a logbook entry, surely.
Yes. So with that, any final comments from any of our other facilitators?
Parag, while leaving, if I can put one more controversial comment, as you started with, saying that if a visit doesn't have a competency to be achieved, which is a skill based and is not going to be logbook, probably is wastage of everybody's time. So whichever visit, there should be some competency, and target on skill based competency will achieve the purpose.
Yes, sir. So even our logbook is short, we should be fine. We should not be ashamed of having a shorter logbook in asking the students for less number of activities to be observed. It would be good to have less number of activities actually observed rather than having a very large logbook, which is just a superficial record keeping exercise.
Okay, so we have already exceeded our time limit. So with that, I would like to thank all the facilitators for their very nice inputs. Today we had a very nice discussion about all the different aspects, and we had a very nice learning experience, the entire group. And so I would like to thank our entire group and all the participants for attending today's session. Can we conclude the session now?
Yes, madam.
Yes. So with that, I
Thank
would
you,
like
madam.
to thank you, sir. We would like to conclude today's session. Thank you, everyone.
Thank you, ma'am.